devolution was the word or the pilot that we've engaged with, and we very deliberately tried to avoid that phrase in many ways, because we see devolution as enabler. What we're trying to achieve is transformation through integration, and I think those are the words that it's easier to galvanise people around and get some movement around. So our aim is pretty simple. It's to deliver integrated and sustainable health and well-being and a social care system for Hackney. And the sustainable bit being very important, acknowledging that we're trying to do this in times where there's less money around. The priorities we've set out are very similar to those that we've heard from other people. I think what I've learned today is what we're doing is not necessarily innovative. We're on the same journey as many other people, and the work we're doing is very much in line with what's happening in the vanguards. I think though in Hackney there are some bits that make what we're doing a little different. So why devolution? So Hackney's characterised in many ways, or is quite fortunate by the way that it's set up, which makes the devolution pilot a very interesting proposition. So we have a single CCG, we have a single acute provider covering largely just the City and Hackney area. We have a single local authority, a single GP confederation, and a very well coordinated community and voluntary sector. So we felt that taking forward devolution as a pilot where we can work across the boundaries of a single borough was something quite interesting and exciting. What can we do by getting all of those partners working together? So the first thing, we've been doing a lot in Hackney over recent years, but the devolution journey is fairly new. I've put up here the partners that are involved in the board that we've got that's taking this forward, and it's very much a joint partnership. So the local authority, the acute provider, we're also the community provider, the CCG, the voluntary sector, the GP confederation are all equal partners in the transformation board, and we meet regularly and we're working on this together. That has its benefits, of course, but it also has its challenges. It means that we all need to try and move together at the same speed, and I would echo what others have said today, that one of the biggest challenges or the main ingredient is making sure that those relationships are strong, and you can only really move forward at the pace that everyone wants to move forward together. This can't be rushed. And very much, I think we have a culture in Hackney of putting local residents and service users at the centre of what we're doing. And in the work that we're doing, we have a number of work streams, but one of those is around communication and engagement. And that work stream is chaired by an independent person who leads our local PPI committee, and also by Healthwatch. And that brings some different challenges and approaches to the work that we're doing. Okay, so why devolution? What makes devolution different? As I said earlier, we see it very much as an enabler. It's not an end in itself. And we started out on this journey with a long list of things that we thought devolution might be able to deliver. But actually, when you start to work through them, many of them start to fall away. There's so much that we can do already, so much that's in our gift that doesn't need devolution. And I think actually it boils down to a couple of key areas that we're now focusing on. That's the finance and capitated budget area, and something around estates. So around finance and capitated budgets, I think the challenge that's emerging for us is how does the system facilitate us to set up a capitated budget quickly and easily? Does it support joint commissioning? Some of the structures that are in place at the moment can be quite cumbersome and don't necessarily allow joint governance around commissioning. So that's one of the areas we'd like to focus on. And also some work and support around how you actually make a capitated or population budget work. What on earth does that mean? And how do we deliver that? And then secondly, on estate. The estate picture, as people know, is very complex. Anyone that knows Hackney will know that only 5 years ago, no one wanted to live there. Now, everyone wants to live there. That means addressing the estates issues becomes even more challenging. People that had no interest in the estate only a few years ago are now highly interested in our estate. So how do we unlock that, where everyone's interested in real estate that has a huge value, also has many tenants on it, also has many landlords? The easiest thing to do is do nothing. How do we cut through that? I know nothing about Haringey, so I'm going to go back one slide. So I think that's mainly what I wanted to say. So we've tried to boil down devolution to the one or two things that are going to make a difference. But we're acknowledging and realising that actually through partnership and working together, there's a lot that's in our gift already. Thank you.